Okay, so this is our prone lower leg work, which we will also then transition into the plantar fasciitis protocol. So to start off, lower legs and calves, sorry, my hands are cold, can be really tender. They can just be really sensitive. So, approach slowly. And while you still have dry hands, dry client, you can do some wringing and twisting is a pretty attainable fascial therapy here, and just slowly meet the barrier of resistance in the skin. Wait, eventually it'll start to lengthen a little bit. Go the other way. Take longer than I am currently taking. For your fascial therapies, you can also do a pin and stretch, which in this case we would hook with our fingers and stretch away, just kind of soaking into whatever layer is your goal. Maybe you're right at the superficial layer of the skin. Maybe you're soaking in and hooking the deeper layers, just whatever's appropriate for you. Is that amount of pressure okay? Mm-hmm. Okay. So then we want to soak into the calf. Now, with our massage therapy, advanced therapeutic protocol, plantar fasciitis protocol, the first step is the calf anyway, because the plantar fascia comes through and around, wrapping the heel and continuing on up the calf. Any effective plantar fasciitis treatment should also include the calf, whether it is stretching, physical therapy, massage, whatever. You always want to include the calf. So so the first part of our plantar fasciitis protocol is like a good solid amount of general relaxation massage on the calf itself. And this is going to include, we're going to do good old effleurage, we're going to do some petrissage, we can do scooping petrissage, we can do kneading petrissage, and we can be palpation led as we address any areas of found tension as we go. If we are gearing up for a plantar fasciitis treatment, in addition to just plain old vanilla general relaxation, we also want to make sure that we have a substantial amount of ironing. Some people call this stripping, where you sink to your depth and you maintain that depth as you glide proximally towards the heart. We also always want to make sure, if we're gearing up for a plantar fasciitis treatment, that we include a little bit of stretching. The classic stretch is to just lift the leg here and leverage that stretch through the foot so that you're elongating the calf by putting a bend, dorsiflexion bend into the ankle. And so you would do that, and you would do it more than I just did it for this demonstration. But taking that aside for a moment, let's just pretend that we are here because the issue is in the calf, because this is also our prone lower leg work. So here, coming up the heel, can you see that in the camera?
Mm-hmm.
Yeah, okay. So coming off the heel, we have the calcaneal tendon, called the Achilles tendon in layman's terms, and it comes right off the heel bone, the calcaneus, coming up, and then it's going to kind of divide, but not left and right. It's going to divide superficial and deep. The superficial branch is going to spread out, and can you point your toe really hard? Here we go. And here's this client's bellies of gastrocnemius. You can relax. It's going to spread out into a wide fascial sheath, and then it's going to come up to the gastrocnemius bellies, which are up here. Some artistic interpretation was used. And so in this client, they're here. They're going to be higher or lower depending on the client. And then deep to that, we have soleus, and soleus is going to poke out the sides, medial and lateral, and it's usually got a little more tension in it than gastrocnemius, at least here in Western land, in my experience with my clients. Bear in mind, underneath this broader part of the calcaneal tendon, as it's leaving the ankle and coming up here, we do have a bunch of toe and ankle muscles that are in this lower area as well. So we're going to see gastrocnemius and soleus up here, and the little nitty-gritty little toe muscles more down here and coming through the lower or distal half. So if I'm addressing this in terms of thinking about the muscles themselves, I first want to palpate and find gastrocnemius, which on this client, gastrocnemius itself doesn't seem to have a lot of action. It would feel like a lot of texture and tension superficially in those two muscle bellies. Not feeling a ton of that, which it doesn't surprise me. Soleus is the prime mover in terms of plantar flexion, so I would anticipate going deeper into the body and finding that tension deeper in the calf and deep to even some of this fascial structures, which is exactly what I'm feeling right here. How's that treating you?
Yeah, it feels tight. It's not necessarily painful, but
right. So you don't have to lean in with your full amount of pressure. Again, if this is a good place, you can do alternate techniques. Just don't use your full body weight because, again, calves can be sensitive. So coming in here, you want to assess and find the structure, assess its state, address it with our protocol, right? So starting with general relaxation, doing some long strokes, which are part of the plantar fasciitis protocol anyway, and then nitty-gritty cross-fiber friction, trigger point therapy, whatever you find. Then find soleus, that deeper muscle. Really palpate the layers. And bear in mind, on the lateral leg, there's going to be ropies. Those are a different muscle group. We'll hit them separately. Be palpation led. Start with our good relaxation and then go into the nitty-gritty. Include that ironing. I'm doing it in this way because the camera is kind of, I guess we can kind of do it this way or here, right? And these muscles are going to come right up here, making sure that we are careful of our client's popliteal fossa. And then you would include also these nitty-gritty little muscles down here. When you get to the Achilles tendon, whether you start there and go up or start at the knee and come down, we want to have like a pincer palpation where we're scooping it up and kind of rolling it back and forth. And I'm paying attention to the texture of the calcaneal tendon. It should be smooth and uniform. If it feels like it's got little nitty-gritty sandy, like sandpaper nodules in it, those are potentially tenosynovitis, which would be an adhesion between the tendon and its sheath. And if we've got anything that feels like a mass of connective tissue, just like a big old gnarly spongy mound stuck to it, that's potentially a former injury site. Anything that's really textury, we want to hang out. If it feels, however, like part of it is frayed or broken away, that we do not want to release more. That would be recommending our client go to the doctor because they've had a partial tear of their Achilles or calcaneal tendon, and they need to be scanned and assessed by an actual diagnosing professional if you see signs like red flags for that. And we're going to come down, and we can even cross fiber friction and assess as that tissue is coming around, wrapping the heel, right? So step one in class is going to be to do this full calf workup, paying attention to the layers, gastrocnemius, soleus, little toe muscles, and calcaneal tendon. In real life, if we were just doing plantar fasciitis, we would do general relaxation, make sure there's some stripping, make sure there's some stretching, and spending at least 5 full minutes, if not 10, on the calf, depending on how much action there is. I know this is getting to be a long video, but I'm just going to go ahead and also do any questions. Is that pretty clear? Yeah, okay. And then we would start the foot. And the foot starts the exact same way as all of our therapeutic protocols. Remembering we've got the point of calcaneus is going to be coming down somewhere in there. And then there's going to be that thick tendon. And it's going to, sorry, it's ticklish, I know, I'm sorry. And it's going to spread, I'll stop drawing. It's going to spread out along the foot. And there can be plantar fasciitis symptoms anywhere along the plantar fascia. The classic spot is in the heel at that attachment, but there can also be in the arch or really anywhere. So we'll start again with good old yummy general relaxation on the foot. I like to include kneading petrissage and ringing here. These are just kind of good ways to soften the foot. So you'll do that good old yummy general relaxation, and we're palpating. We're being palpation led in terms of where that that puts us in our where we're focusing. After that, now we're going to mobilize the entire plantar fascia. So you would do that general relaxation for a little bit longer than I demoed, and you're going to come in and you're going to find the edges of that plantar fascia, and you're going to drag and shift it. Drag and shift. You're not really cross-fiber frictioning, you're like more trying to mobilize. Drag and shift the whole plantar fascia, especially anywhere that's really stubborn or textury. Try to get it up off the surrounding tissue. You also want to be ironing. So this is where, again, you can come in with a fist and iron in alignment with the fiber direction, which is this way. Some people have strong opinions that you should go towards the heel in the case of a bone spur. I don't have a lot of personal experience that it matters a ton, but maybe it does. It's anatomically, with my own body mechanics, a little easier to go towards the toes, so that's what I often do. So we're going to do lengthwise, we're going to go transverse, and once we've really relaxed, lengthened, mobilized the fascia, then that is when we finally are going to go in with those nitty-gritty little cross-fiber friction, trigger point therapy, remodel that collagen, and work on stubborn areas. Once we have normalized as much of the tissue as we can with the more broad general work. And we want to be spending at bare minimum of 15 minutes on this full leg. Probably closer to 20. It depends on the client and how much time you have in your session.